on to this story now. Medical schemes are up in arms over the Council for Medical Schemes' decision to scrap primary health insurance and low-cost benefit packages. It's reported that the regulator issued a circular in December saying primary health insurance plans wouldn't be permitted after March 2021. For analysis on this, we're joined by a health insurance consultant, Kerry Hertog. Kerry, good morning.
Good morning.
In simple terms, what exactly is going on here?
It's not medical schemes. It's medical insurance that we're talking about, and it's part of a demarcation exemption framework that started, it's been ongoing for many, many years. And eventually, December 2016, things were agreed upon by various parties, Treasury, Department of Health, insurance parties, etc. And April 2017, it all came into effect. And medical insurance, it was, because it does the job of a medical aid, was then dual regulated by both insurance, which is FSCA, regulatory body, and also Council of Medical Schemes. Council of Medical Schemes are mandated through the Medical Schemes Act to look after the interest of medical scheme members. A medical scheme, yes.
Key reasons for the regulator to do this?
Unknown. It caught us, we've been blindsided by it because there was an exemption phase, we all applied to it. Part of the exemption phase was at the end of a 2-year exemption period, we would have an LCBO, low-cost benefit option framework in place, and we'd be able to move the medical insurance products, the low-cost products, into a regulated framework. That wasn't available at the end of March 2019, and there was a rollover phase. And we're in the rollover phase expecting an LCBO framework. Circular 80 is issued, says medical insurance companies, come March 2021, there's no run-off. You are terminating all your policy holders, and there's no LCBO framework for you.
Wow, out of the blue. Who's most affected?
Consumers, communities. The Council of Medical Schemes doesn't know who the bases are, I don't believe. They don't realize that employers are paying 100% contributions and allowing people access to private healthcare, unlimited visits to GPs, your radiology, pathology, optometry, dentistry, chronic medication, acute medication. These are all elements of the products that we provide to the various communities and employer groups, starting at 200 Rand, 300 Rand. Obviously, as you take more benefits, you would pay more.
Yeah.
But it doesn't cost. It's an affordable alternative to medical aid, but your benefits are limited.
Do we have any recourse as people who subscribe to these packages?
Well, I said last week, Thursday, we created a healthcare stakeholders forum, and we got talking, and now the bus has left and there's lots of people on it. It's just gained momentum, and tomorrow we are going to be at Council of Medical Schemes with a memorandum requesting that, politely requesting to please rescind a Circular 80 or amend it.
How favourable do you think that call is going to be from the Medical
Council?
We
did have a stakeholders engagement session in January where Dr. Kwani did indicate that he wanted to sit down and discuss and find a common ground, but we've heard nothing since then. So his initial commitments to us as a group of insurers, community members, there were community members involved as well, sick funds. There's probably about 2 million people in some way that are going to be affected by this ruling. And they will then have to, they aren't going to be able to buy up into a medical scheme space. They're going to have no cover.
In your view, what's the big idea behind this decision?
The circular refers to aligning medical schemes and council with the NHI bill. And
is that the agenda?
That's the agenda, and the agenda is good because, yes, universal health coverage, NHI, but from now until 2026, when there's no real formal NHI and things aren't going as quickly as they should, where do those members go? And they're going to land up in state. They're going to land up in clinics, relying on the state infrastructure, which is already under pressure. There's a massive burden of disease in the communities. And these products are affordable and give them access to benefits. And now it's been pulled out from underneath all of us, not just the insurers.
Well, let's see what the Health Council tells you tomorrow. That's when this big protest is.
9 o'clock, and we're saying to everybody, come join us. Wear a white shirt and come and see what's happening.
Cheers. Kerry Hertog, thank you very much, medical insurance consultant.
Consultant.
Thanks indeed for
Thanks so
taking
much.
the time to speak to us.